17th of April is celebrated as the World Hemophilia Day, and it is good that we bring an awareness of what is hemophilia and how we take care of patients with hemophilia. So hemophilia is a sex-linked recessive disease which is characterized by excessive or prolonged bleeding, and it is a hereditary disease which usually is sex-linked on the X chromosome. It affects more men usually because of its sex-linked trait, and it is also recessive. So you'll find that it's very rare that you have females presenting XX chromosomes that are genetically mutated to present with the hemophilia. But for men, because of its sex linkage, then you have the X chromosome and the Y chromosome. So essentially, there is no protection of the X chromosome, and so they will manifest with the hemophilia. So the common presentation is with the excessive bleeding, and usually because of this sex linked mutation, there is an abnormality in the clotting factors. So there are 13 clotting factors which are involved in the clot formation. But in people with hemophilia, you have a defect in factor 8 and factor 9. When you have a defect in chromosome 8, then you have what we call hemophilia A. And then you have a defect in clotting factor 9, you have what is called hemophilia B. The presentation, as I said, is with excessive bleeding, which can present with easy bruising. You have lesions over the skin. You can also have excessive nose bleeding. Patients can also have vomiting of blood. You can also have hematuria, which is urination of blood. You can also have excessive bleeding, especially after either a cut or a tooth extraction. In some situations, you may have bleeding from the joints, which can lead to what we call hemarthrosis, where you have accumulation of blood in the joints, which can affect the knee joints, can affect the elbow joint, can affect the ankle joint, and also sometimes the hip joint. Then you also have bleeding into the brain, which can be fatal. The good news is that it's not a common occurrence. So patients, how do you diagnose hemophilia? Usually there are blood works, where we start with a complete blood work, where you have platelets are normal, which is one of the major factors in the clotting process. Then there are tests we call our prothrombin time, and also we have the test we call the partial thromboplastin time. For patients with the hemophilia, the prothrombin time is normal, but then you have the partial thromboplastin time is increased. And then when you find this, then you are supposed to do specific test for the hemophilia factor, and you specify whether the patient has a deficit in factor 8 or factor 9, which is the confirmatory test. The treatment for hemophilia is injection of the missing clotting factor, and this really is life-saving for these patients. And also, of course, the supportive care when they come with pain from joints, and they are also, we should avoid drugs that can stimulate bleeding, especially drugs like NSAIDs. We also have aspirin, which can cause this kind of patients to bleed a lot. Then the patients should also be advised to avoid contact sports. These are kind of sports that involve any kind of aggression, because any slight trauma is likely to make these patients bleed, and this can be fatal. So these are among the rare diseases, but they have impact on the patients who have them. It's always good to realize as a society that we need to also be empathetic with these patients and provide the necessary access in the healthcare system so that when these kind of patients present, we have as health providers, we have the know-how, and also as a society, there is need to continuously fund the healthcare system, so that some of our colleagues who are disadvantaged, when they need some of these clotting factors, then they can have access to them. We realize that at the moment they are only available in a few selected facilities like Kenyatta, but also the county government should also take up the challenge, so that we take care of these patients who have some of these rare conditions. For the people who have hemophilia, we wish you well, and we hope that our health systems also will respond appropriately to the needs of the patients with hemophilia. Thank you.